This is Michael Hahn, and from now on, I'm going to talk about achondroplasia. The definition of achondroplasia is rare genetic disorder characterized by an unusual large head with a prominent forehead and flat nasal bridge, short upper arms and legs, unusually prominent abdomen and buttocks, and short hands with fingers that assume a three-pronged position during extension. The other name of achondroplasia is short-limbed dwarfism. The part of the body that disorder affects is it affects your entire body. Symptoms: the people who have achondroplasia has different physical appearance, but they actually have same intelligence with normal people. Physical difference as a child: a short statured that's significantly below average for age and sex, short arms, legs, and fingers, a large head compared to the body, a large forehead, and an underdeveloped area of the face between the forehead and upper jaw. Health problems as an infant: decreased muscle tone, aphania, hydrocephalus, or water on the brain, spinal stenosis. Symptoms that children and adults may have is they may have some difficulty bending their elbows, they may be obese, they may experience recurrent ear infections, develop bowed legs, develop an abnormal curvature of the spine called kyphosis or lordosis. And they may develop new or more severe spinal stenosis. Diagnosis: there are two ways, and the first one is during pregnancy. At first, they check with the ultrasound, and then if they see a larger head or difference in physical appearance, then they have a genetic test and look for the FGFR3 gene. And the second one, they may check after a child is born. They can determine by looking at his or her feature. Is it inherited? Is the disorder inherited? Yeah, sometimes. Which chromosome is affected? Achondroplasia has an autosomal dominant and inheritance pattern, and also it's caused by FGFR3 gene. Inheritance: about 80% of the cases are not inherited, but around 20% of the cases are inherited. Is it dominant or recessive? It is a dominant disorder. Possible parents' genotype: parents can be both dominant and recessive, and also it's resulted by FGFR3 gene. Description of how it occurs: for the majority, around 8%, it's caused by spontaneous mutation in the FGFR3 gene, and for the rest, 20%, parents pass down a defective FGFR3 gene to a child. The karyotype of an achondroplasia would look the same as a normal person, because this disorder does not have to do with abnormal chromosomes. Chances of a person with this disorder passing the disorder to their offspring: if one parent has the condition, the child has a 50% chance of getting the disorder. Life expectancy: Well, they usually have a normal life expectancy, but they have larger risk of getting ill, uh, pretty much like heart problems. Treatment. There are no cure or specific treatments. If any complications arise, then the doctor will address those issues. How possible is it that a cure will be found? Well, researchers think that they can find a cure, but they don't know the exact time. How prevalent is the disorder in the population? Achondroplasia occurs in approximately 1 in 25,000 live births. It's equally common in males as females. And since I couldn't find the right statistic graph for the prevalence, um, I just posted the percentage distribution of various skeletal dysplasias. And there are no significant type of people who have more risk of getting achondroplasia.